touch on bracing. When do you
Yes.
use
So
abduction bracing, or when,
yes.
or how
So
long?
you have to. So here's the thing. It's kind of like, I don't know if you guys had dental braces. I did growing up, and I never wore my retainer. And shockingly, my teeth kind of went sort of back to where they were before
Yeah.
we started.
Yep. Same
So
here.
that's the
Yep, same
analogy
thing.
I give. That's the analogy I give to every parent, which is, look, the orthodontist can put you in braces, but if you don't wear your retainer, your teeth are going back. And it's the same thing for the feet. So my first visit with these families, whether it's the prenatal visit or it's the first time I meet them postnatally, I go through the entire thing where I say, my treatment phase is somewhere between 3 and 8 casts. Your child may or may not need an Achilles tenotomy, but your child will definitely be braced. Now, the duration of bracing is debated very intensely. Ponseti, when he first described it, said, oh, up to 2 years you can brace. Had about like half his patients relapse. So then he extended it to between 5 and 6 years. I will tell you that it's the true Ponseti acolytes stick to 5 years. And when I say acolytes, I mean like they are disciples. They
Yeah.
are out there like hardcore preaching about the true Ponseti way. If you talk to a lot of people out there who are treating clubfoot, it varies between 3 to 5 years for the most part. And so the thoughts of bracing are that you must brace until at least their third birthday. And the reason is because that child is still rapidly growing and the foot's going to try to go back to its original position. The forces pulling it back into the original position are the original tightness of the muscles that cause it in the first place. But you can also run into some issues with the tibialis anterior tendon, where if the tibialis anterior tendon is attached slightly more proximal or slightly more plantarly than it should have been on the dorsum of the first metatarsal and the medial cuneiform, and it's a little more on the medial surface there, you'll get what's called dynamic supination. So when you enter swing phase of gait and the foot needs to dorsiflex so the toes can clear the ground, you have more of a varus and supination pull than you would otherwise have. And over time, that can cause you to get a more static deformity of recurrence of your adductus and recurrence of your varus. And so that is the most that and true equinus are the deformities that you'll see come back. What is clear is that you should treat recurrent equinus. What isn't clear right now is what is the specific trigger to do a tibialis anterior tendon transfer. Is it isolated? Like if you identify in a 4-year-old dynamic supination, should you take that child to the operating room? We don't know yet. Or should you wait to see if that child does develop dynamic supination that results in a static deformity? It's very debatable. I'm pretty aggressive on that because I would rather not have to tell a family you got to brace a kid for 6 years if I can just treat the dynamic supination now. Because I don't know if you guys have kids, but I can tell you by their third birthday, a lot of these parents are done with bracing.
Yeah.
Yeah.
Yeah. But that's the importance of bracing, and this will be on your test questions, where it is the most important factor for recurrence is failure to comply with the bracing protocol. And I stress that with the families. I don't blame my families for anything. I'm a very, it's all on me, kind of the buck stops here kind of surgeon. But I let them know, man, if you guys stop bracing, you're gonna guarantee your kid a relapse.
Yeah, and you say you braced to the age of 3, and
Yeah.
I think you did a great job describing the dynamic supination. I read that many times in the past, and I understood it, but I didn't really understand it per se.
Yeah.
But your explanation was great as far as
Once you see it, you'll never,
yeah.
you'll never, like, that's why it's so important. Like you said before, when you go to examine a baby, you get a sense of how you're supposed to do it. It's the same thing. A lot of this is, I will tell you that my residency, I was trying to get in the OR as much as I could, right? But you really do learn a lot in the clinic if you pay enough attention. And I really tried to avoid a lot of clinic as a resident. And as a fellow, I started to realize, oh man, I'm going to be seeing these people in the office way more than I'm going to be operating on them. So I better learn how to be an office physician too.
Yeah.
And so once you see these kind of things, you won't forget it.